Hello everyone, and welcome to this audio podcast. This audio podcast is part of a Biome edition. This audio podcast is part of a Labostix Vortex. This audio podcast as part of a Phantom newscast. This audio podcast as part of the Abstrax, and this audio podcast as part of a Cyclone bonus too. In this audio podcast, a little bit of a backdrop to a particular a particular a particular a particular sort of document in regard to improving the standard of care of children or pediatrics with kidney disease through pediatric nephrology networks, which was originally developed developed between the British Association of Paediatric Nephrology, or BAPN, and as part of a working party of the Royal College of Pediatrics and Child Health, Royal College of Pediatrics and Child Health, and at the time NHS Kidney Care. The In this audio podcast a little bit in regard to this particular document from 2011, and looking at improving the care of children or pediatrics with kidney disease. So there are around 13 tertiary centers for pediatric nephrology in the United Kingdom. Of which 10 provide renal transplantation services. The geographical area covered, the population served, and the number of hospitals from which the tertiary centers receives referrals varies, and thus the model of services is necessarily different for each region. The care of children with renal disease is not confined to tertiary center, and many children or young people live long distances from tertiary center and have care delivered by local services. Uh, at the time of this document, in around 2011, provision of care or healthcare is not always or is not always or was not always joined up across traditional organizational boundaries. Although robust evidence is or had been scarce, the fragmentation can has resulted in a lack of quality in both in regard to in regard to quality in regard to has there's been a fragmentation in regard to aspects of quality and access to healthcare. The focus of the document primarily have been has been had primarily been in regard to pediatric patients or recipients, and looking at the same time investigating how structured, formalized sort of networks of healthcare or care provision can provide a coordinated and high quality pathway of care, and also providing as much treatment or healthcare as possible close to pediatrics or young people suffering with varying forms of kidney disease, whilst ensuring the best outcome for children or young people. And the aim had been to provide one of the main aims around the document had been to provide guidance for those commissioning and providing and using or utilizing pediatric nephrology networks. The the work also is works in regard to bringing networks to life. A Royal College of Pediatrics and Child Health publication setting out the vision and strategy strategy for high quality pediatric care within networks, and with which there are many principles in common. And standards have been taken from sort of a broad range of national documents and are referenced. Uh, and so additionally, the report have been developed by a working group of experts convened by the British Association of Paediatric Nephrology, and again the Royal College of Pediatrics and Child Health, and included sort of representations from healthcare professionals, patients, patients and carers, and towards the latter parts of the actual document, towards the latter part of the document, of the Nephrology Networks document, there is a sort of a list of sort of contributors sort of appended and again in towards the latter part of the document. And also to inform that the document is and should be available is and should be available through the Royal College of Pediatrics and Child Health, if not directly through the British Association of Paediatric Nephrology, or BAPN. That draws this audio podcast to a close. This audio podcast, as part of a Biome edition, this audio podcast as part of a Labostix Vortex, this audio podcast as part of a Phantom newscast, this audio podcast as part of the Abstrax, and this audio podcast as part of a Cyclone bonus 2.